Hello, my name is Dr. Jared. I'm here to give you some more tips about how to get the most out of your sessions, most out of your evaluation. This is going to cover how to drive commitment from your patient. One of the biggest challenges in virtual care isn't what happens during the session, it's what happens after. Most patients don't drop off because they don't care. They drop off because they're not fully convinced that it's going to work or that it's for them. What we typically see is we prescribe exercises, outline a plan, and move on. Do these exercises at home. We'll meet again next week. But we don't explain why in a way that truly connects. Currently, the standard is typically to give the plan and the patients will follow it. But in reality, adherence isn't driven by instruction, it's driven by understanding and belief. If patients don't understand why something matters, they're less likely to do it. If they don't see the value, they won't prioritize it. If the expectations aren't clear, follow up becomes very foggy. So, even with a good plan, outcomes will suffer. So instead of just giving a plan, we need to build commitment around it. And that comes down to a few key things. First, justify your plan. Explain why this plan matters and what it leads to. Based on what you're seeing, you can say something like, based on what you're seeing, this plan um, will help reduce the patient's symptoms and improve their movement over time. And you can go into much greater detail because that's pretty generic, but you want to hit that point. Make sure that you explain that. Next, you want to make sure you justify the exercises. Explain the purpose of each exercise, not just what to do or how to do it. Explain what the point is. This exercise is targeting the muscles that are weak, and because they're weak, they're causing the impingement of your shoulder. That ball and socket needs a strong rotator cuff to hold it in, otherwise, it bumps and impinges. And um, if we strengthen them, the pain goes away. The pinching goes away, and then the pain goes away. So, um, once you've explained your exercises, you want to make sure that you prioritize using the app. Prioritize using the exercise platform. Make sure patients have a few key exercises clearly assigned and easy to access on the app itself. Emphasize the importance of logging their exercises and their pain levels consistently. Um, Having the patient come back to the app regularly, not only do they get to keep track of how things are going and access their exercises, this also creates accountability and helps guide progression. It keeps them coming back. It keeps them focused on us. Third, you want to set clear expectations. How often should they do this? What should they expect next? Establish communication clearly. Let them know exactly where to reach you. For example, through the app's message feature, they can access a message line directly to you in the top right corner. Make sure they know about that. Hey, Mrs. Smith, moving forward, you can reach me anytime. Please do it. You log in, top right corner, the little message bubble, that's where you can find me. You can also offer a phone number if needed, so they will feel supported between visits. I tend to do that. Finally, build consistency early by setting the schedule. So as you're aware, we do 4 visits out on that eval, and then 2 to 3 visits a week for the first few weeks. And this is done even for higher level patients. The consistency is super important. What we see is that if they don't have twice a week, they're way more likely to fall off. Their visits per episode for those once a week patients are dramatically less, not because they're getting better faster and stuff, they're just falling off. So it's better to do twice a week, even with a higher level patient, because without it, it's very unlikely that they're going to get any benefit from the care at all. So here's an example of how you can bring it all together. You can say something like, based on what I'm seeing, this plan will help improve your movement, the one that hurts you, and reduce your symptoms. These exercises are specifically targeting the areas that need support. I've added them to your program. Make sure to complete them daily and log your progress in the app so we can track how you're doing. If anything comes up, you can message me directly through the app or reach out if needed. We'll plan to meet a few times per week over the next couple of weeks to keep things progressing, and I'll build on this in our next session. So, In closing, this doesn't take a ton of time. Many of you are already kind of doing something similar to this. Uh, but when you do it right, it changes everything because now the patient understands the value, the purpose, how to stay connected, what's expected. And that's totally a big part of what drives follow through and how to get more buy-in, more consistency, and so on. Better outcomes for everybody. All right. Thank you.